This is another marginal application of DEBRICHEM that I'm going to develop together with my podologist at my clinic. And it's related to the use of DEBRICHEM in the treatment of pyogenic ungual granuloma. What's it, pyogenic ungual granuloma? It's caused by drugs, sometimes by mechanical injury, by peripheral neuropathy. It's a chronic systemic inflammatory disease. It is a frequent condition faced by podiatrists. It's sometimes a critical condition because it's a frequent case for resort to podological treatment. It perceived as an urgency by the patient. Patient compliance regarding home medication is difficult. Sometimes you need a long time needed for complete healing after the lesion is removed. It causes increased pain and bleeding during podological treatment, and this is a concern because, at least in Italy, podiatrists cannot do anesthesia or surgical procedure. And moreover, there is not a consensus over the treatment. So we try to use DEBRICHEM in the treatment of this condition. We now know that DEBRICHEM is a Class 2B disposable medical device. It was created for a chemical debriding of defective wounds. It could be potentially ineffective in treatment of ungual and pyogenic granuloma due to its drying, hemostatic, and antimicrobial properties against the biofilm, the pathogens, and the inflammatory protein. And the potential advantages of the DEBRICHEM in this condition is that it's very effective in only 60 seconds, is easy to use also by the podiatrist, does not cause bleeding, and does not damage the surrounding healthy tissue. See, this is a patient with a pyogenic granuloma of the nail. A bit of nail was already removed with anesthesia. And you see the product is easily applied with a stick. And what you see is that the granuloma almost instantaneously dry, and you can remove completely, you see? You can detach the granuloma from the bottom without any drop of bleeding. So you do not have to use scalpel or other kind. You see? So in a minute you can remove the granuloma without bleeding, having a complete antimicrobial activity of the lesion. We have at the moment treated 5 patients. In all cases we have an immediate destruction of the granuloma, no bleeding consequence. At 1 week follow-up, all patients were in remission. So also the follow-up after this procedure is very simple at home. So in conclusion, even if this is a very short experience, I highlighted the DEBRICHEM as a selling opportunity for the treatment of ungual pyogenic granuloma. At the moment there is not a cost-effective analysis, and also we do not have a specific product for the situation. But maybe in the future we can provide all podological office with this kind of product. Thank you for your attention.